Diabetes is caused when our body cannot properly process or utilize sugar from the food we eat. There is an amount of sugar that is supposed to be in the blood during the fasting stage, and this amount is 70 milligrams per dl to 100 milligrams per dl. That is 70 milligrams of sugar per deciliter of blood to 100 milligrams of sugar per deciliter of blood. So that's the normal range of sugar that is supposed to be in the blood during the fasting stage. And by fasting stage, we mean that you've not had meal, you've only drank water within a period of 12 hours before you carried out that test. That is fasting. So if blood sugar is above 100 milligrams per dl to 125 milligrams per dl, we consider that to be pre-diabetic. And pre-diabetic means that you are at a high risk of being diabetic. Diabetes is actually when blood sugar is above 125, that's from 126 milligrams per dl and above for fasting blood sugar. Blood sugar is tested using the glucometer when you just prick your fingers and you take a little sample of that blood upon a strip, put it in the glucometer, and it does the reading. It's a very simple and inexpensive way of testing for sugars in the blood. So what causes diabetes? What causes an increased level of sugar in the blood? One is that your body, the pancreas, which is an organ in the body that produces insulin, is not functioning properly, so it's producing little or no insulin. Or the pancreas is producing enough insulin, but the cells of the body is not responding to the insulin. The body cells are insensitive to insulin. So we have type 1 diabetes and type 2 diabetes. In type 1 diabetes, there is little or no insulin because of the damage to the pancreas, while in type 2 diabetes, there is enough insulin, but the cells are not responding to the insulin. Type 1 diabetes is usually found in younger people. It has an early onset and is usually caused by an autoimmune disease or maybe other diseases that attack the pancreas and destroys it. While type 2 diabetes most times is caused by, it's found later on in life, and it's mostly in adults, and it's caused by inactivity, bad diet, and maybe a family history. What are the risk factors for diabetes? The risk factors for diabetes includes a family history of diabetes. So if there is somebody in the family that has diabetes and diagnosed of diabetes, then there is an increased risk of having diabetes, especially if this person is your brother, your sister, your mother, or your father. We also have race, ethnicity. Some ethnic groups are more predisposed to having diabetes. Sedentary lifestyle and physical inactivity increases chances of having diabetes. If there is another condition like high blood pressure and polyovarian syndrome, there is also an increased risk of having diabetes. If you are taking alcohol and smoking cigarettes, that's tobacco, that also increases your chances of having diabetes. If you also have low level of high density lipoproteins and or you have high cholesterol, that can actually also increase your chances of having diabetes. Gestational diabetes too also increases chances of having type 2 diabetes. So what's the gestational diabetes? Gestational diabetes is when there is an increased level of blood sugar during pregnancy. For some people, when they are pregnant, their sugar levels increase, and but after pregnancy it could go back to normal. But if it doesn't go back to normal in some people, then there is now type 2 diabetes. So if there was gestational diabetes, or a lady put to bed to a child that weighs more than 9 pounds, there's an increased risk of developing type 2 diabetes. Well, diabetes usually do not have symptoms, but sometimes if there are symptoms, then you will be noticing something like increased thirst, frequent urination, increased hunger, blood vision, fatigue or body weakness, and later on there might be other complications or more damage to blood vessels, to the eyes, to the nerves, and to the kidney. So you actually diagnose diabetes, or you get to know you have diabetes by doing a regular sugar test, and the recommended sugar test should be the fasting blood sugar test, which you do early in the morning before you have your breakfast. That's if you were fasting all through the night and the only thing you took was just water. That's how you get to know if you have diabetes. There are really no symptoms to show most of the time. What are the preventions? How do we prevent diabetes? So we prevent diabetes. You could prevent diabetes by ensuring that you cut down on processed carbohydrates, so you take in low carbohydrate meals. You should also avoid sedentary lifestyle. Physical activity is recommended. Exercise, go to the gym and increase the chances of your body cells taking up glucose and burning it out from your blood cell, from your blood. You are also advised to take more fruits and vegetables, and if you have a family history or you know that you are in a high risk group, ensure that you do regular checks so that you can actually use lifestyle modification to prevent yourself from getting to the diabetic state. So diabetes is treated. For some people, insulin is used, so there is injection of insulin to supplement the inadequate insulin in the body. For some people, you might need oral medications to help reduce blood sugar level, and they work in different mechanisms of action. It is advised that if you do a test and you realize that your sugar level is high, you should go to the hospital, meet your doctor, and your doctor will prescribe the best medications for you, or will give you advice on the best lifestyle modifications to use if you are in the pre-diabetic state. If you're required to take medications, when you go to pick them up at the pharmacy, try to have some time with the pharmacist so you would be advised on how to use these medications properly to get optimum results. Also, it's also advised that you do a regular foot examination, because diabetes could lead to food ulcers. Basically, the nerves are not really functioning properly, so there is less sensation on the foot, so you could have an injury but you do not know about it, and that could actually lead to foot ulcers, which is one of the leading causes of amputation. So regular foot examination is advised. Check your foot every morning. Do not wear tight shoes, and if you notice any deformation or discoloration or injury on your foot, report to the hospital and talk to your nurse or to your doctor so that treatment will be given to you in time. It is also advised that you cut down on your carbohydrate meals. We are not saying don't take carbohydrate, but do a low carbohydrate meal. It's also advised that you meet a dietitian who could help you plan your diet.